Want to take a close look at the National Health Insurance Scheme, which was set up in 2004 to remove the barrier of cost in the access of healthcare in the country. Now, some private healthcare providers have been sharing their experiences working with the National Health Scheme.
Imagine being sent to a hospital with a bleeding accident wound and asked to pay before a doctor attends to you. You may die. Many have died for the simple reason that there was no money around to make the required advanced payments in similar cases. So in 2004, the government of Ghana started implementing a National Health Insurance Scheme, NHIS, to remove costs as a barrier to access quality healthcare. This changed the healthcare system significantly and had far-reaching consequences for healthcare providers.
It wasn't easy giving care for cash and carry. At times, you give the treatment, the client comes and tells you that I don't have money. Then at times even they will bring their clothes, collect this and then let me go. If I get the money, I'll come and collect the clothes. Some bring beads and all those things. And I saw that, in fact, in the area, they are all peasant farmers. And a few are traders. So they don't have much income. And it has been a problem for them that they can't pay for their hospital bills. So I thought it is going to relieve both the clients and myself.
When the health insurance scheme was introduced, it led to a remarkable growth in the number of people seeking care from the maternity home. During the first few years after being contracted by the National Health Insurance Scheme, the scheme reimbursed her facility on time, resulting in an increase in the income level of the maternity home.
It was very smooth because I could pay my workers, and I could buy my drugs, pay for my utilities, and do other things. That has even helped me to be able to put up a stand maternity home, because I was not having the administration block, I was not having the storeroom, and I was not having records room. Also, I couldn't, though I provided water for the clients, it wasn't regular, it wasn't on regular basis. But then I was able to provide all these things.
Another health facility is the Pentecost Hospital. It serves as the municipal hospital for the La Nkwantanan Medina municipality in the Greater Accra region. 80% of its clients are registered with the National Health Insurance Scheme.
When we were running the 5 facilities with a cash and carry system, people were detained, some could not pay, and as a facility, some people also absconded because they could not pay. So before you realize they've absconded from your facility with your money. So the expectation was that this project or intervention is coming to help us.
During the first few years after the facility was accredited to provide services under the health insurance scheme, the hospital expanded its facilities and employed more nurses, doctors and other healthcare providers because payment of claims by the NHIS was very regular. Generally, expectations and experiences of healthcare providers with the NHIS were positive.
I remember when we started operations, we hadn't gotten the accreditation yet, and so it was basically cash and carry. And to interest you to know, you come in here, and you have sometimes the whole day 5 people. Sometimes I come and sit there the whole day, you have less than 10 people. And the very day we got accreditation, and then we posted the notice that the place is now NHIS accredited. Then the numbers from nowhere started going up, and it increased from 20, 50, up to now. I'm talking about a daily attendance of 120, sometimes 150.
In November 2013, about 10 years after its inception, the NHIS was named the most efficient health insurance scheme in West Africa by the Security Watch Africa, an international organization which prioritizes issues of security across the continent, including food, health, water, and sanitation. At that time, the NHIS had a subscriber base of about 10.2 million people, representing 39.4% of the total population. The scheme is currently operational in all 170 district offices across the country.
So the biometric system now, it has helped to reduce, the case of impersonation, so to speak, people using other people's cars to attend hospitals and all that. I think it's a very, very good point. The other ones too that I can talk about is the fact that we do get regular visit from our scheme managers here, just to try and find out the problems or challenges we are facing and see how best they can solve them so it doesn't keep on festering.
The Anton Memorial Hospital is located at Kutubabi in the Greater Accra region. It sees about 3,000 patients every month, with over 70% of its clients being NHIS card holders.
We can talk about the payment of the claims, which is a very, very huge point. In the contract, there's a period after submission of the claims when you are supposed to receive, payments for the claim that you have sent. 3 months, there's supposed to be a 3 months period where the claims, you send the claims are vetted. And then after they've been vetted, 2 months later you are expected, it's assumed that it takes 1 month for the vetting to be done and completed. And then 2 months later, we are supposed to get the payments. Unfortunately, that has been one of the biggest challenge for the NHIS. Now, presently, as we sit here, we are behind by about 5 months, if you take into consideration that 3 months gap period. So 8 months now.
The NHIS is financed through multiple sources. The major sources of funding are a national health insurance levy of 2.5% on certain goods and services, 2.5% monthly payroll deduction being part of the contribution to the Social Security and National Insurance Trust (SNIT) for formal sector workers. Currently, the members from the informal sector pay between 7 cedis 20 pesos and 47 cedis 70 pesos to the scheme. However, the core poor, pregnant women, pensioners, people above the age of 70 and those below 18 years are exempted from premium payments. There is no other cost sharing or co-payments with the NHIS except the premium paid. These major sources of financing the NHIS does not generate enough revenue for the financing of the insurance system. The tariff regime used by the NHIA to reimburse healthcare providers has not kept pace with the rate of inflation and the fall in the value of the cedi. The low tariffs, coupled with delayed payment, have resulted into significant financial challenges to especially private service providers who are heavily reliant on NHIS.
The other challenge also that we have is about the tariffs that are paid for the services, especially for the drugs. Because the cost of goods on the open market keeps on rising by the day. Unfortunately, the NHI, the National Insurance Authority, is not able to review their tariffs as regularly as they should. So we get to the point where we purchase drugs that the NHI pays less than how we purchase them. In that case, it makes it very difficult to run the system. When the patient comes to pay, what do? Do you supply the person with the drug that you do not pay?
In order to remain financially viable and to deliver the needed care to the clients, management of the hospital rely on incomes generated from its corporate clients. The facility also depends on revenue from some private health insurance companies whose card bearers receive care at the facility. Hospital management at Anton are working hard to add more services like dental, eye care and a new theatre. All these services will not run under NHIS because the management believes the scheme will not pay on time.
In fact, they are keeping long paying the monies. Apart from that, we need to pay our workers and look at the large number, the 80% of them being our clients, and this monies go and it doesn't come. And getting drugs are also very expensive, and they are not also paying very well. Delivery like this, they are paying about 36 Ghana cedis, which is an insult. Staying with a woman sometimes for about even 24 hours or 18 hours, and then delivering the woman have to stay in the clinic for another 24 hours before you will discharge the woman, and then you will be paid 36 Ghana cedis. It's really not adequate, and for some time, the clinic is running down. I have to lay some of the workers off because I can't pay them. I have even let my accountant. I'm now taking him just for maybe for some look or whatever I will say. He's not now full because I can't pay him for the full time. So I've asked him to find another job and then just come maybe once in a week to do 1 or 2 things for us.
At the Adams Family Maternity Home, 80% of the clients seen here are NHIS card holders. So when NHIS claims delay, the facility suffers financially. One visible burden which comes with the delays in claims reimbursement is that providers are unable to stock the pharmacies with the revenue generated from the uninsured clients.
When we come to delays in claims processing, it starts from our providers. And to say that our providers need to submit their claims timely. A lot of instances, upon occurrence of an encounter with our subscribers, it takes for some providers well over 4 months before submissions of those claims to us. Now on submission, it takes us averagely 40 days to process them for the claims to go out to our finance directorate for reimbursement. Now, a lot of the delays are just due to funding. And the finance directorate too has to then prioritize that based on availability of funds to reimburse our providers.
In a recent report to Parliament on the performance of the NHIS, Ghana's health minister said there has been consistent funding gaps with the scheme. In 2014, the funding gap was in excess of 299 million cedis, and it is projected to reach an astonishing 803 million cedis in 2018. The only way of solving the problems associated with the delays in payment of claims is by closing the funding gaps.
The first area is the funding gap. We are faced, the scheme has grown. Okay, the thing has grown over the years. Okay, from 2005 to date, from 2005, the total amount of claims we paid was about 86 million or 80 million was the total claims we paid in 2005. But as I speak to you now, okay, the total claims that we paid in 2014 is about 986 million. Ghana City, look the jump. Look the jump. So the claims have risen very fast, but the revenue that fund these claims has also been rising, but at a very gentle pace. So this has caused some gaps since 2009. So the first thing that we are asking for redress is to increase our funding sources. We need more money so that the gaps, if the gaps are there, we delay in paying claims. See, so once government can find other means to fund the National Health Insurance Scheme, this problem of delaying claims payment will be solved, and the scheme will become sustainable.
Providers believe the NHIA has to educate Ghanaians about the services covered by the scheme. When the NHIS was introduced, most Ghanaians assume that all NHIS card holders could walk into any of the NHIS accredited health facilities for healthcare and receive every type of service without paying for the service directly.
What I could see was that during the enrollment, some politics were played, and so the public were not told the truth. And so what all the education they did was that once you have the card, you have free service, free healthcare delivery, which is not so. I mean, there is no insurance in the world which covers everything. You are limited to the premium you pay determines what service you receive.
NHIS covers 95% of the diseases in Ghana, but does not cover services like cosmetic surgery, assisted reproduction, and private inpatient accommodation.
I think that we've also proposed some reforms to the system. If they could bring in those reforms on board, either they let us go co-payment, patient will be allowed to pay a little bit to support, or they don't like that one, they could increase, the VAT, or maybe some portion of the oil revenue coming in to support, the revenue they generate for NHIS. These are reforms we've mentioned to them. We don't know how the government is going to take it up. But I guess that if they're going to tap in something from oil revenue, increase a little bit of our VAT, a little bit of NHIS levy, plus other interventions, I'm sure it should be sustainable. It's an intervention, it mustn't collapse. If you collapse it, the ordinary Ghanaian will suffer.
Under the present arrangement, all the NHIS levies collected by the Ghana Revenue Authority go into the consolidated fund.
It's all about money. It's all about money. The NHIS money should be separated from the government coffers. I think it should belong to the Ministry of Health. So at any given point in time, when we need more money or when we are demanding our money, it could be sent to us. I think our money is with the consolidated fund of the nation. So it's like robbing Peter to pay Paul. When other sector of the nation is suffering, money is pushed there. Meanwhile, our money should be separated.
The funds that are being, mobilized for the NHIS should be separated from any other thing, so that an authority can, monitor it or control it or manage it, and then use it specifically for the purpose for which it's been designated. Because healthcare, it's something all of us, it is so important. I think it's so important that we need to look at it and give it an exception. When we do that, I believe that the payment of claims and things, I think it will help to improve it.
NHIS can be sustainable if we remove politics out of it. We should run NHIS as an institution, as a separate entity from government. What is happening now is that the confidence of the public is going down of the NHIS. Their confidence is going down because of, one, the politics that are coming into it, two, because of lack of education of the general public about the operations of the NHIS.
Pharmacists, through the Medical Credit Fund (MCF) and its partner bank Unibank Ghana Limited, has introduced a UniHealth loan. Through a UniHealth loan, healthcare providers like Anton Memorial Hospital and many other private healthcare facilities have accessed loans to renovate their facility or purchase medical equipment. In addition, they benefit from businesses and medical quality improvement services under the Safe Care program.
Assuming somebody is a healthcare provider is being owed some amount of money, let's say claim for August, for instance, or maybe July, that person may bring it to us and tell us, please give me a good portion of the money. When National Insurance Authority pays me, take the money and then give the rest to me. So we immediately discount 70% of the claim, however huge it is.
With the National Health Insurance Scheme, the health-seeking behavior of Ghanaians has improved significantly. The NHIS requires urgent financial reforms to remain sustainable. Private healthcare providers do not want the NHIS to fail.
But the NHIS has come to stay. For 12 years, we have relied on the NHIS. So if all of a sudden the NHIS is removed, there's going to be chaos in the health sector.
Most healthcare providers believe the success of Ghana's NHIS is a key driver to achieve universal health coverage and an effective health delivery system in Ghana.